Hello everyone, my name is Paul Hector Porras. Currently I am student of Saskatchewan Polytechnic Regina campus, currently taking mental health nursing NRSG 106 under instructor Mariam Nganso. I'm currently taking RNBP RTP program, which means Registered Nursing Bridging Program, Re-entry to Practice. I want to talk about major depressive disorder. What is major depressive disorder? It is a mood disorder that generates incessant feeling of unhappiness and loss of interest. Also called depression or clinical depression, it affects how you feel, think, and behave and can lead to a variety of emotional and physical problems. You may have trouble doing normal day-to-day activities, and sometimes you may feel as if life isn't worth living. Risk factors for major depressive disorder are certain negative personality traits such as low self-confidence, being too dependent, too critical, or negative thinking, traumatic events such as death, loss of a loved one, physical or sexual abuse, family relatives with a history of bipolar disorder, suicide, alcoholism, and depression, being LGBT or lesbian, gay, bisexual, transgender, or having variations in the development of genitals that aren't male or female in an unsupportive environment. History of other mental health disorders such as anxiety disorder, eating disorders, or PTSD. Alcohol or drug abuse, serious or chronic illness, and certain medications. Anatomy and physiology of the brain for people with MDD. Neurotransmitters that are involved are serotonin, norepinephrine, dopamine, acetylcholine, gamma-aminobutyric acid, and glutamate. Norepinephrine, acetylcholine, and serotonin play a role in stress regulation. What happens is if there's a stressful event, there will be an overtaxation of norepinephrine, serotonin, and acetylcholine, which may lead to neurotransmitter depletion, which will then lead to reduced neurogenesis. There will also be a hyperactive hypothalamic pituitary adrenal axis, which may then lead to increased urine cortisol levels and CRH, which means corticotrophin releasing hormone. Another theory that can relate to this is monoamine deficiency theory. It predicts that the underlying pathophysiologic basis of depression is a depletion in the levels of serotonin, norepinephrine, and/or dopamine in the central nervous system. Decreased serotonin will lead to decreased norepinephrine and decreased dopamine, but right now it has limited evidence. Decreased tryptophan, another amino acid, will then lead to decreased serotonin and then which will cause symptoms of depression. Patient profile is JB, age 24, sex male, culture Filipino in origin, community Moose Jaw, living arrangement solo, living in a one-bedroom apartment, diagnosis is clinical depression, history of psychobiological disorder is a new onset, comorbidities is none, social supports are friends at work, and just moved to Canada within last month. He came to the hospital, he punched a wall and had a broken hand. He just recently broke up with his long-distance partner just recently. The nursing therapeutic communication for patients with MDD are empathetic listening, which is active listening combined with empathy, and you allow for silence. Another one is using open and collaborative communication, which means an example will be is to tell me more about how you feel. Offering self, which means being present with the patient. Reflecting, an example will be what makes you think that way. For nursing diagnosis plan and intervention, the nursing diagnosis that I've chosen are self-care deficit related to weight loss of 15 pounds and risk for self-harm related to clinical depression as evidenced by client punching the wall last week breaking his hand. The plan will be, for the first one, it will be client will have improved appetite and be able to start eating normal again and with focus on balanced meals of healthy and nutritious foods 3 times a day. For the second nursing diagnosis, the nursing plan will be client will not harm himself or others. The nursing intervention I've chosen for the first one will be nurse will teach client about importance of eating healthy as part of a proper coping mechanism in dealing with breakup of his long-distance partner. Then second nursing intervention I've chosen for the second nursing diagnosis is nurse will promote client safety and prevent violence towards self and others by activating safety measures as per hospital protocol. Ensure that the client is in a safe environment via close monitoring. Nurse evaluation and treatment outcome. The nursing evaluation will be client now has understanding that nutrition is important and that he has a plan to start eating healthy foods again. Client will identify at least one resource for community support and crisis intervention hotline should his negative thoughts arise again. For the treatment outcome, the nutritional needs are met and starts to gain weight of at least 1 to 2 pounds per week. Client is safe from harm and no longer has thoughts of harming himself or other people. Client is following his pharmacological regimen properly as prescribed by the physician. For pharmacological intervention and patient teaching, the medication chosen is sertraline. Drug classification is SSRI, or which means selective serotonin reuptake inhibitor. For patient teaching, read medication guide first before taking the medication. This medication is usually taken once in the morning or in the evening. It can be taken with or without food. Do not use alcohol or marijuana while taking this medication. May cause dizziness, drowsiness, lack of sexual drive, and insomnia. Inform the nurse if there are any of these symptoms will appear. It may interact with other medications. Talk to your physician for the list of all medications that the client is taking. Do not take with Maui or another antidepressant drug, monoamine oxidase inhibitor medication. It will increase risk of serotonin syndrome. Do not work with heavy machinery while using this medication. Monitor for side effects and do not discontinue taking the medication abruptly. It may cause serotonin withdrawal. Community support resources for patients with MDD. I have chosen FH Wigmore Regional Hospital Mental Health and Addiction Services under Saskatchewan Health Authority. The address is 55 Diefenbaker Drive, Moose Jaw, Saskatchewan. If in immediate need, go to the nearest emergency department for counseling and programming, mental health support. Contact the centralized intake program at 306-691-6464. Information can also be found at fhhr.ca/mentalhealth.htm. CMHA or Canadian Mental Health Association Moose Jaw Branch. The address is 326 High Street West, Moose Jaw, Saskatchewan. Contact number is 306-692-4240 and Healthline 811. That is the provincial health advice for and can give mental health support. They are open 24 hours a day, 7 days a week. For crisis hotlines, I have chosen 911, 988, Suicide Crisis Helpline, and the 24/7 Regina Mobile Crisis Services, and their number is 306-757-0127. All of the numbers mentioned above are available 24 hours a day, 7 days a week. References: Mayo Clinic, Osmosis from Elsevier, and Varkarolis Canadian Psychiatric Mental Health Nursing, A Clinical Health Approach, 3rd edition, published by Elsevier, Canada. Thank you, everyone. Hope you guys learned something from me today. Have a good day.